have questions about imaging tests for breast cancer. How do women with breast cancer know which tests are appropriate?
The appropriate imaging tests for breast cancer depend on a few factors, primarily the stage of the cancer and whether you've had any prior surgery.
What if the cancer is stage 1 or 2A?
For stages 1 and 2A, we focus on detailed breast imaging. This typically includes a mammogram, an ultrasound, and an MRI of the breast. We might also use contrast mammography or an ultrasound of your underarm area.
What do those tests show?
A mammogram is an X-ray of the breast. Ultrasound uses sound waves, and it's good at showing the difference between cysts and solid masses. MRI uses magnetic waves and IV contrast to provide very detailed images. The underarm ultrasound checks the lymph nodes.
What if the cancer is stage 2B or 3?
For stages 2B and 3, we do the same tests, plus a PET-CT scan. The PET-CT scan can help show if the cancer has spread. We might also recommend a bone scan or CT scans of your chest, abdomen, and pelvis.
What if someone has already had a lumpectomy?
If someone has already had a lumpectomy and has no new symptoms, regular mammograms are important. We might use contrast mammography or a breast MRI. If new symptoms appear, we might recommend more imaging tests.
If someone has had a mastectomy and reconstruction, do they need to continue having breast imaging tests?
After a mastectomy without new symptoms, we might use breast MRI for screening. If new symptoms arise in the breasts, an ultrasound is often helpful as a first test.
Are regular scans of the rest of the body needed after treatment for breast cancer?
Not routinely, unless you have new symptoms. If that happens, we might use tests like a brain MRI, bone scan, CT scan, or a PET-CT scan.
Thank you.
You're welcome. Always ask if you have more questions. We have provided links to additional information and resources in the More Information section below.